On today's All That Chaz Stress Relief podcast, the top 10 myths about massage therapy. Hey, if you've got pain, if you've got stress, then you may want to consider visiting a massage therapist. How to find one? Try to get a personal referral. Word of mouth is the most powerful way to go. Talk to somebody who's had a massage so you can go get a professional massage. Rates vary per location and aims vary per location. About 20% of the therapists that work in my jurisdiction work in spas. I think it's about 20% the last time I checked. So there are people who work in rehabilitation clinics, work with chiropractors, work with physiotherapists. Whether your aim is stress management, rehabilitating injury, relieving pain, massage therapy may well be for you. For insurance coverage, you may need to see your doctor, or so check your insurance coverage because massage therapy coverage is all over the map. But whether you have coverage or not, it's something you should seriously consider if you can get to a massage therapist because it is a glorious experience. And why are you denying yourself this? It's one of the joys in life. And if you have pain or injury, it can really save you a lot of problems. So, today's podcast is about the top 10 myths of massage therapy, and let's get right into it. First off is the most common thing I hear. Number 1, no pain, no gain. The truth is we can achieve great changes without turning it into a test of anybody's manhood or womanhood. We aren't here to torture you. Your massage therapist is here to help, and it doesn't progress you to go straight to deep tissue too quickly. The thing is, a lot of people think, I'll need to get a deep tissue massage, but maybe your body isn't ready for a deep tissue massage. If your muscle is too tight, if you go straight into deep work as hard as you can go, then you're going to try to coerce the body rather than coax it. And when you do that, you get something happen where the muscle actually tightens up more. We don't want to tighten up the muscle. We want it to be soft and vascular and pliable because soft tissue is meant to be soft. So if you go into your massage therapist and you pride yourself on how tough you are and start talking about your pain tolerance, then we have to have a discussion about how, now your muscle is like a rock, and if we rush into it, then we're just going to make it worse. And there's a lot more to it than just applying pressure. If it was all just about applying pressure, then you could do it at home with a rolling pin. And there's a lot more to massage therapy than that, trust me. Number 2, oh no, I forgot to shave my legs. I hear this probably about once a week. I never hear it from guys. So, ladies, let me assure you, I don't care. No massage therapist cares whether you shave your legs or not. It really does not matter to us. There's a few guys who we treat who shave their legs who are usually cyclists, serious cyclists. But we're not judging hairy legs, and we don't mind, and we don't care. It really is not a factor. Bonus point, we know that you hide your underwear underneath your clothes. It's the last thing you take off. If you take it off, you don't have to take it off. In fact, a lot of people I treat fully clothed. But my point is that, we know you're hiding your underwear, whether you're a man, whether you're a woman. People do that. And I don't know why. I don't know. It doesn't matter. We're not here to judge you. And it's okay. Just come in, get treatment in a non-judgmental atmosphere. We're here to help. And judging does not help. Hey, there's a third bonus point. It applies to everyone, everywhere. Now, number 3, massage therapy is just a passive therapy. It doesn't do anything. Well, not the way I do it, and that's true of many therapists. I look at each treatment as a course correction. So if you come to see me for an hour, I'm not going to be able to fix all your problems in that hour. Possibly. A lot of times I actually end up doing that. But I'm not focused just on the hour I'm with you. At the end of the session, I typically suggest remedial exercise and tactics that will help you along the road to recovery, to rehabilitation, and to increased ease of movement. We're looking at improving your posture, increasing symmetry, increasing strength, increasing flexibility. So you give me a locked up muscle like a torticollis is a frequent thing that happens each summer, where I often have people come in and they can't move their neck. They can't check their lane when they're driving. And the reason for that is often in the summertime, the heat is up, they turn on a fan, and they lay in bed. They don't move through the night too much, and a fan blows cold air over their muscle and chills it, and then they wake up with a stiff neck in the morning. Actually, a pretty common thing. I can typically fix that really quick. People can be in pain for quite a while. They can be locked up for a week, 2 weeks, 3 weeks with a torticollis. Come see me. I'll do some special tactics, and because I've got special weapons, so I can do special tactics. And bingo, bango, bongo, you're fixed. However, I also suggest some neck stretches to follow up so it doesn't come back. I also suggest that you don't point the fan directly at your body as you sleep each night. So, look, there's a lot more to it than just pressure. I often joke that, if you could take a smart rhesus monkey and you could teach him massage. But that's me being modest. Let's be real. There's a lot more to it than that. If I could boil down the top 10 myths about massage therapy, the quick answer is there's a lot more to it than that. Number 4, massage is just a feel-good thing. This is pretty close to the massage is just a passive thing. The research suggests it's much more than just making you feel good. The goals and scope of practice for massage therapy include, and here's the official thing from the College of Massage Therapists of Ontario, our regulatory body. Massage therapy is the assessment of the soft tissue and joints of the body and the treatment and prevention of physical dysfunction and pain of the soft tissue and joints by manipulation to develop, maintain, rehabilitate, or augment physical function or relieve pain. Short answer, as far as just a feel-good thing, some of the treatment that we do will be a little bit uncomfortable, but you'll feel a lot better afterward. So we're really... There's a lot more to it than just a feel-good thing. There we go. Number 5, anybody can massage. Actually, professionals take extensive training to treat the body and to know when not to treat the body. If you want professional body work, hire a pro, and you'll soon see the difference between that and the work of an amateur. So I know that there are people who take couples massage courses, and if a fella massages his partner, A, might get very distracted, and that's not what a pro massage is about. No happy endings with a professional massage. The other thing is there's more to it than that. There's tactics, there's posture on the part of the therapist. What I'm saying is, if you just take a quick course and do massage, your partner probably won't get an hour massage, and certainly won't get an hour massage regularly, because pretty soon the amateur will start complaining about wrist pain, and then they'll need to see a pro massage therapist. So hey, I'm not discouraging from anybody from doing massage, because there's professional and there's amateur, and you can do both. Just like there's professional baseball and amateur baseball, and anybody can do both. And well, not everybody can be a pro, but my point is that there's more to it than that. I went to school. I already had a university degree, but then I went to a private school. It was 2,200 hours of training was the standard, I believe, or 2,400 hours, something like that. And we learned not just practical treatments. We also learned anatomy, physiology, neurophysiology. We learned how to interact with other medical professionals. Short answer, there's a lot to it, a lot more to it than that. And it was not an easy course. It was not a bird course. I know some people think massage therapy is a joke, and then if they actually get into the curriculum, it's actually quite challenging, and it's serious. Okay, so number 6, women can't massage as deep as men. That, folks, is a myth. Now, my joke when people tell me this is, I prefer men to massage me. That's okay. You can have your choice, whichever you prefer. But let me tell you that my joke is, hey, are you looking to get bruised? What I suggest is tell a female therapist that you think that, and then go get a treatment, and she'll show you that she can give you lots of deep pressure. A lot of it is using body weight. And if you need more than the weight that a human being, whatever their size, can deliver, assuming your therapist is not a small child, then hey, that's plenty of pressure. Again, you don't need a whole lot of pressure to achieve some significant results. So massage therapists are pretty savvy about using techniques that are effective on you, but also don't incur a lot of wear and tear on their bodies because they've got to work on several people each day. So what I'm boiling it down to is therapists, male or female, can typically provide all the pressure you need. And if you need more pressure, ask for it. And if you need less pressure, ask for it. What I tell everybody is there's one rule in massage therapy that is number one, and that is there's no crying unless I do it. So when I lean in and use a well-placed elbow on a trigger point in the piriformis muscle, blah, 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 I expect it's a conversation not only with your muscle but also with you, because we want to get the soft tissue to be soft, but we also get a lot of feedback from the client saying, is that enough pressure? Is it too much pressure? What number would you put on that discomfort between 1 and 10? And we manage it so it doesn't become overwhelming. And we also keep an eye on it to make sure that the treatment is effective. There's a treatment plan. There's an intake interview. There's an outtake interview. We want to make sure that we're on track all the way through the massage to keep it effective and results-oriented. Number 7, the myth is massage therapists need you to go back again and again before you get results. Okay, that's simply not true. I look for a result that I can measure with every treatment. Every treatment. I'm looking for some change in tissue texture. I'm looking for an increase in range of motion. I'm looking for something that I can palpate, something I can test, something I can observe. There are subjective measures as well. But when I am working with somebody, I am looking for a measurable change. So I take a baseline idea of what I'm looking for to change before the session, and then at the end of the session, I'm looking for some improvement there. If that does not improve, then I may change tactics. I may refer out, whatever is appropriate, because, hey, I'm not out to soak anybody. Nobody's getting rich as a massage therapist, okay? Certainly not me. I am results-oriented, and if I don't get those results, I want to know why. So, some people come back on a regular basis just for the stress management, and, I don't know what you do for a living. I don't know what your stressors are and how stressed you are. So maybe you do need to come back more often than once every 3 weeks or once a month. Some people come in just when they feel they need it. Some people come in very regularly, depending on their druthers and depending on their needs and depending on what we're working on, what we're trying to change. If you've had a long-standing problem, it would be kind of unreasonable to expect that it's going to disappear very quickly. But the way I work, I typically find that a lot of problems do disappear quite quickly, or at least show some improvement. And I don't keep on treating people over and over again without finding some improvement, without them feeling that they appreciate the work and they're getting their money's worth out of it. I am very strong on making sure that people have lots of things to work on when they get home, the homework, because everybody loves homework, that will consolidate the gains they get from the massage. Simple as that. Number 8, massage isn't for serious problems. Well, as a guy who's been treating people for a long time, I can tell you that there are lots of serious problems and not so serious problems that massage therapy can help with. So I don't pathologize pregnancy, but if you are pregnant or going through a pregnancy and you the aftermath of pregnancy, I should have said, and you want to get treatment for massage, I wouldn't consider that a problem per se. I'd consider that helpful, though. I don't cure cancer, but I do provide helpful care to people who are undergoing cancer treatment and other serious conditions. I've treated many chronic pain conditions. I see people on a regular basis for all kinds of problems that are pretty serious musculoskeletal conditions. So the most common issues I deal with are headaches, neck pain, shoulder injuries, and low back pain. Those problems are very serious to anyone who suffers them. Number 9, massage is all fluff and buff. Okay, if your experience of bodywork is limited to a massage on a Jamaican beach on your honeymoon, I can understand that misapprehension. As detailed above, we do use multiple techniques to help patients with many conditions. That said, there's nothing wrong with relaxation massage. Maybe a lighter, stress-relieving massage is just what you need. Approximately 20% of the people in this profession do work in the spa industry. As I mentioned, they're giving a relaxation massage that'll leave you drooling and asleep or relaxed. It's an hour in heaven, and I highly recommend it. There's nothing asked of you for that hour, and a relaxation massage is a treat for the senses. There is absolutely nothing wrong with a relaxation massage. You don't have to have a problem, per se, to go receive massage therapy, and not every massage session has to be a treatment, per se. But it's not all fluff and buff, no. But I just don't want you to feel like, after hearing this, that it's all so serious or also just relaxation, all nothing. It's much more complicated than that. Hey, came back to it. And finally, number 10. Massage feels good, but it doesn't last. Okay. Here's the problem with that myth. I can't control how your body will react to treatment, but how you react largely depends on the body you bring to the table. As I mentioned above, I help put the soft tissue in an optimal state. Soft tissue needs to be soft. Once I've reduced your trigger points, those are those knots in your muscles, once I've reduced your pain, the hypertonicity where the muscle's too short, it's up to you to keep the good feelings going. So I suggest those therapeutic exercises, the self-care tips. We talk about, hey, do you have an ergonomic workstation? Do you get up from your desk regularly? Do you have a sedentary lifestyle? Are you changing that? Is that something you've thought about? Because maybe sitting too long is irritating your back. There's all kinds of tips and tricks that I actually mention a lot in Do the Thing, my book by Robert Chute. You'll get that at go to the website allthatchaz.com, and you can pick up the book, and that'll give you a lot of tips on stress management, pain management, and time management as well. So stress, pain, time, and energy. All those things can be changed a lot by all the things you do every day. And here's the thing about what I do. I talk to everybody about how I can give you the treatment, but it's what you do every day that can really lead to long-term improvement. So I might suggest self-massage, for instance. I might suggest that you use a tennis ball in a strategic way to treat yourself between appointments. So I'm happy to help anyone with their pain and stress management needs. If you're in London, Ontario, if you're in that area, you can go to massagetherapyscience.com to book an appointment. And if you're not in the London, Ontario area, talk to a friend and say, hey, I need to get a massage. Who is good? Who have you seen? Who helped you out? Get a personal recommendation and enjoy massage therapy, because massage therapy can help you with all kinds of problems. And even if you don't have a problem, it can help you with your stress. And this has been the All That Jazz Stress Relief Podcast. Have a great week and go get a massage. And don't suffer those myths anymore, because it's more complicated than that. Take care. I'm Robert Chute.